Hi there, welcome to the Heartwater Farm channel. It's Arthur here. Today we'd like to look at the common health issues in goats and really how to handle them. There are so many challenges that come, and some of these we learn on a day-to-day basis and see how to handle them, and some of them we get advice from our vets on how to go about it and how to tell that, something's off with a particular animal. First, one of the common challenges normally we face as goat farmers is diarrhea. Now, diarrhea, you'll find that it's generally caused by either worms, eating toxic weeds, or for those that are doing zero grazing and you've done some silage, and if you have not kept it well and it's maybe getting rotten, and once the goat eats that, also will of course experience diarrhea. And now, the way we normally treat it on our farm, we normally use sulfadime. These are tablets that we normally dissolve and give a particular goat. We find we're giving it, like, let's say, 2 tablets per day for 3 days. In most cases, you'll find that it has gotten better. Sometimes we experience the diarrhea or bloody stool for the young goat kids. For that one, we also use sulfadime, but we make sure to split it. That big tablet, we divide it into 4 pieces, and we give a piece each day for 4 consecutive days. We pound it and dissolve it in water and put the amount of water that is sufficient for the young goat kid to be able to drink, and we give it. So once we monitor that, some little bloody stool, we normally give that, and you find that it is well treated and recovers properly. The other challenge that we normally face, goat farmers face, here we faced it only once. That was Heartwater, but these were from the flock that had acquired and come with, but it already had those challenges. This is where you see the goat turning and moving around on one spot, and it can be quite a scene when you look at the way it behaves. And so we were able to call the vet. The vet came and administered a combination of oxytetracycline and some other drug. So once you have an issue of Heartwater, when you sense that your goat could be having a disease of Heartwater, that is, when you see it, first of all, one of the signs, it could start, other signs are bringing maybe saliva, but also moving round. Just try to get in touch with your vet immediately, and he'll be able to guide you on exactly how you can be able to overcome that challenge. If you detect that disease early, you're able to save that goat. But if it's late, in most cases, they'll just die off. The third one is lymphadenitis. These are abscesses. You find goats that always have these swellings on the body, around the neck, around the head, even other body parts. It's quite a common occurrence among goats, and if not treated well, actually, if you handle it well, badly, it can actually be persistent among your flock. And so this one, we normally leave it to ripen or soften. You keep on checking until you feel that that spot, that round node is actually soft. You get surgical, blade, and you cut it open, then be able to press that pus out. Make sure you press it. The goats will feel some pain, but that's supposed to be that way. And then you get a cloth or some wool and clean inside that wound to make sure that you're removing all the residues of the pus that is in there. And then you get, aerosol and spray. That one will also make sure that the flies don't continue disturbing. But we also get pen and strip, 3 mils if it's a big goat, and we also inject it because it helps in healing some of the goats that have wounds and infections like those. So you apply 3 mils of penicillin, just because now it has turned out to be a wound, but make sure to spray aerosol around that. Aerosol, first of all, has some treating element, but also ward off the flies that would want to be disturbing this. And in no time, the goat will normally recover. But once you remove all that pus, ensure to get a hoe and bury it, or put it in the pit latrine. That way, you make sure even where it is dropped, if it is fallen down, pick it up, because it's a bacterial infection and can easily now attack or infect another goat. So once you treat it well, you'll find when you don't have those such cases among your flock. But if you handle it badly, that's when you'll keep on seeing them reoccurring, either on the same goat or even the other goats. The other challenge we normally face are fleas. Fleas normally occur, especially during the dry season. They can be a menace. Or if you have even if it's in the wet season, but you have an area that is dry but dusty, you'll normally see fleas coming up. And these fleas can be a menace, especially to the goat kids. They suck a lot of blood. And actually, fleas can actually kill a goat kid. Remember, a goat kid is having limited immunity. The immune system is weak. And fleas alone, can dehydrate and suck out this blood from this goat and really cause a lot of problems. So what we do, we normally get doo-doo dust and we spread it on the goat skin, but try to do it in such a way that you spread it as you open the fur and make sure it reaches in beneath the skin and be able to make sure that whole powder is there. But we also go ahead and spray inside the kid's pen and also underneath to make sure that we are killing all off. Alternatively, if you don't have doo-doo dust, you can get soap, mix soap and create that foam and be able to bathe those kids, the goat kids. You can bathe them with either Omo and so forth and take it for 3 days. There you'll see when you are, warding off all these, infections. It is important to continuously check. At least every after 2 days or 3, go and check. And especially if you release them and you see them scratching themselves and so forth, just know that they have fleas. And if you have one, you just get one of the goat kids and check it underneath and so forth. You'll see. If it doesn't have, then you consider it clean and continue maintaining the hygiene. But if it's there, just apply the doo-doo dust and also wash it with the soap, and it will be able to kill off some of these fleas. Now, the other challenge we normally have is ORF. ORF is actually a disease or an infection that can be vaccinated. But when it comes, it does not really kill your animals very fast, but it weakens them actually very quickly. Or if you find that a goat is having wounds, blisters around the mouth, it can affect the tongue, you find it can hardly feed. And if it is a baby that continues to suckle also, the mother, you find also the breasts, the teats having those blisters and so forth. The kid also finds it with lots of blisters inside the mouth, around the mouth. It can actually be it's a very painful disease for the goats when you observe how they are. And actually, if the mother has the blisters on the teats, normally will even refuse the kid to suckle. So the kid can easily die from starvation when it's first of all failing to suckle because it has those blisters, but also because the mother is denying it. Secondly, you will see that as the mother denies the kid from suckling, there's a lot of milk in the udder of the goat and can easily cause mastitis, which is also another disease that's not good for the mother because of the milk that is not coming out. It's natural that when there's milk in the udder, it's either milked out or suckled by the goat kid in this case. So once it's refusing, at least find a way of removing that milk and find a way of supporting this goat kid. But the only way you're going to really avoid this in your flock, once and for all, ensure to vaccinate your animals against ORF. It can be quite a challenge, and this is one of the things we discovered the previous year when we had our goats here, and we didn't know exactly how to go about it until a vet came and identified it right. So it's very important as you study all these, as you keep on acquiring this knowledge, move step by step, with your vet at hand. Vets are very, very helpful, especially when you land on the right ones. Now, the other one, of course, that is a menace sometimes is foot rot. Foot rot normally occurs when you release your animals to go and graze very, very early, say from between maybe morning at around up to around 10 when they still dew in the grass. As they continue walking there, they always get that infection where they get wounds in between the hooves, under the feet, and you find a goat limping. Now, in most cases, for us, what we do, we basically get this goat and press out that pus. If it's not yet there, we just open it up, clean it, and then put aerosol there. We keep on applying it until, the goat recovers. And so the way to avoid that is to ensure that you take your goats much, much later to the grazing field when you know that the pastures have less dew in them, and therefore be able to control the occurrence of that. Then the other challenge is pink eyes. This one, another common health issue on the farm. You find a goat is okay, but it evolves all of a sudden is developing a pink eye. It could be on one eye. I think that's also a bacterial infection, but The only way to treat it actually is more or less straightforward. You just get oxytetracycline, say 20%, and you get those drops and apply in the eye. 1 or 2 drops. But when you apply in this one that has turned pink, ensure to also apply on the other one, which is okay. So you do that, say 3-4 days as you monitor. Once it clears, then you stop. So that one, you just get the oxytetracycline 20% and you just apply directly a drop in the eye. So those are some of the common health issues that normally affect goats. The other issues, of course, are things like worms. Ensure to deworm at least every after 3 months. And if the worm prevalence is so high in your area, either because during the rainy season and you really see that one of the signs is to see that actually, to know that your goats are having worms, they tend to cough so much, others start diarrheating, but cough is the most obvious sign, especially when you have taken some time and you're observing, looking at your environment. If you have pastures that are a little bit low and the goats are not are turning out to be grazers to try and catch this grass, normally because the grass is more or less close to the surface, there are chances that they will develop the worms more faster. So you'll find yourself having to deworm at least every after 2 months. If it is this other where you have your fields and there are tall grasses and the shrubs, that means they are not going close to the surface to feed. There it can take you like 3 months, and then you do the deworming. So that's another practice that you should really maintain on your farm to have a good herd. Thank you very much. If you consider this information helpful, please consider subscribing. Here we share our experiences and how we do our things and be able to see how we can journey together. Thank you very much.